Hey guys, Kent here, the podiatrist from Ergonx, and today we're looking at a patient who's come into the clinic with some pretty severe lateral foot callousing. So what this is when you put pressure in quite a broader area, we get callousing form rather than a corn. A corn will form when there's really quite a point focus on the skin for the pressure. So the patient reports that this one she doesn't like the feeling when it builds up. So she likes to get this one cleaned off about every probably 8 to 10 weeks. On average. So basically all we do is go ahead in with a really quite a broad blade and just remove as much of the callousing as we can without causing pain, obviously. Now the reason this callousing grows here is because her foot rolls towards the outside a little bit more than usual, and she doesn't wear shoes as often as she should. So she's in shoes for work, but then outside of work she's in bare feet most of the time. So there's not a lot we can do outside of the work when she's wearing shoes with an orthotic inner sole, but an orthotic inner sole would usually help limit some of the pressure on this area so the callus doesn't grow back as much. But now what we need to do is be a little bit careful with this one because the callus thickness changes depending on where it is on the foot. So towards the lateral border it's a little bit thicker, and towards the inner border it's a little bit thinner. So we go ahead, remove all the callus, encourage her to use a moisturizer to keep the skin nice and supple like it is, and that's what shaves off so nicely. And then we'll finish this up with a rotary sander to make it all nice and smooth, and it also looks a little bit better when we smooth all the rough edges off. And then then we'll be done with this one, and she's quite happy to come and get this done every 8 to 10 weeks. So we'll just continue to do that and continue to encourage her to wear more supportive footwear as much as she can, or as much as she can tolerate. And then we'll keep this looking good with regular treatment.